Hello, 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 everybody. Welcome, welcome, welcome. Tonight, our guest is Yuberky Hernandez. Yuberky is the mother of a 15-year-old boy, Jonathan, who was originally diagnosed with ARPKD, autosomal recessive polycystic kidney disease. According to the PKD Foundation, ARPKD is a rare genetic disorder occurring in approximately 1 of 25,000 children, equally affecting boys and girls. The foundation goes on to state ARPKD can come as a scary, overwhelming diagnosis. And while ARPKD can cause death in the first month of life, almost 80% of the ARPKD children survive that newly born period. Past that, 1/3 will need a transplant or dialysis within the first 10 years. However, according to the foundation, there's no reason to be pessimistic. Mm-hmm. The prognosis for ARPKD has changed dramatically. It's no longer considered a fatal condition. 20 years ago, only half of the children born with the disease survived till their 10th birthday. Now more than 90% of the children who survived that newborn period reach their 20th birthday, and only 50% of those survivors require dialysis or a transplant. So you can imagine how Yuberky and her husband Edwin must have felt when Jonathan was diagnosed with ARPKD in vitro. In her own words, quote, "My body just couldn't cope. I couldn't lift myself up. I couldn't concentrate or sleep. I had high blood pressure. We felt frightened, powerless, and on edge. We were emotionally numb. It crippled us with fear. We would never wish this on anyone," unquote. Jonathan has had his ups and downs with PKD. Fortunately for him, his parents have learned certain strategies and methods to overcome their initial fears to make clear-headed decisions about their son. Yuberky has turned this gloomy outlook about her son into positive advocacy, not only for the parents of other ARPKD patients, but parents of children with chronic conditions. She started a community Facebook group called Thrive Together, a community to empower patients to find peace and true happiness. And I'm scrolling across the screen now, the link to that website on Facebook. If you go to my personal Facebook page, this broadcast is pinned to the top of that. In the comments to this broadcast, I've put all kinds of links about Yuberky and her Facebook group and all of the things that she does and where you can find her. So if you want to drill down a little bit on Yuberky, you can find that. This group is focused on helping parents and their children live their best lives while dealing with chronic disease. Yuberky also does Facebook events. We have one coming up June 30th. Is that correct? June 30th?
Correct.
Do I have the date right? Okay. Podcasts and broadcasts like this one. She's in the process of writing and publishing a book entitled Beyond Survival, A Parent's Guide to Thriving with PKD. Please give a warm welcome to our friend, Yuberky Hernandez. Yuberky, how are you doing tonight?
I'm doing amazing today, and I'm so happy to be here. And it's an honor for me, Uncle Jim, to be here with you and sharing my story. And thank you so much for inviting me. I really appreciate it.
Oh, it's an honor to have you. Such a terrific story, and I know you do so much for people in the community. I had to have you on. So, did I state everything in the introduction correctly.
You did. You did. Thank you.
Please tell us a little bit about where you grew up, your education, and your employment experiences.
Absolutely. I was born in the Dominican Republic, and I came to the United States like when I was around 10 years old. I didn't speak English when I came to the United States, so I started like so the classes that I used to get, they were all in Spanish, but everything was written in English. So it was so confusing to me to learn and learn that pronunciations correctly when so my English is not 100% perfect. Like my English, let me give you an example how my English is. It's like um you seen the show Modern Family?
Sure.
Gloria. Like my English is like her. She's so cute. But yeah, so that's so then after that I went to college for business administration before I had my son. And I also was working for the Department of Children's and Family during that time. Um, I used to help with public assistance and finances and health insurance for the state of Florida. And I used to love that job. And I was so blessed because when I had my son and he was in NICU, I was gonna quit my job to dedicate 100% my son completely. And they gave me 6 months of pay. They said, "Do not quit. We're going to pay you for 6 months, and then after that, if you want, you can quit." So I was just so fortunate that I was able to have my husband with me during those times, at least for the first 6 months in the hospital, and I was so blessed for that. So then after that, I I didn't go back to work after my son was 5 years old, and I went to work for like an assisted living facility, and I did that for a year, for a couple of years, and then in every job that I had, it was so meaningful, Jim, because working with elderly, it makes you see, it makes you realize that no matter what you have, no matter how much money you have, if you like what like when you at that age, like you almost like at the end of your life, and you go with nothing, and we put so much happiness into things. I want this, I want this. If I get this, I'm happy. If I do this, I'm happy. But if we really think what happiness is, and it really made me realize that what actually make us happy, because these people at the end of their life, they don't have anything. All they want is love. All they want is just to have someone there, and someone to talk to feel fulfilling, to feel love. And it's all about love, basically. It's all about life, it's all about love. And that's what I learned there. And it was just a beautiful thing. Then after that, I worked in the children's hospital in Florida. I work in the children's hospital, and I'm like a licensed, uh, and I'm certified for a nurse technician. And I did work in PQ and also adult ICU. I did also was working in labor and delivery. I also did NICU for a little bit. I did oncology, which was my favorite floor, oncology, where I know that it was a very sad place, where children go through so much, and it's also taught me a lot. But it was one of my favorite floor. I did also orthopedic rehabilitation, pediatric emergency in the emergency room, adult emergency room, adult mental health. Um, and well, I've been in the hospital all over the world, all over the place in the hospital. So that was my experience there, and I worked for 5 years. Then I had to quit because of COVID. I didn't want to bring all this yucky to my home, to protect my son. So I had to leave that job. And then I did a virtual job, which was working for a medical facility slash health insurance, where I helped patients with their benefits and their medical bills, and I also was like um, helping them with anything that related to their health insurance and medical bills. Yeah,
Okay.
and
I
now after that, sorry.
sorry.
Um, I am a life coach, a spiritual healer, and I'm so just loving it that right now. I'm so into this, and it's just beautiful for me to be able to do this.
Okay. And I promise I'm going to ask you about that a little bit later, but we'll pursue that. I understand you are a married lady, correct? Married to Edwin?
Yes, I am.
And is Jonathan an only child?
Yes.
And how old is Jonathan now?
15.
Okay. Let's talk about your first pregnancy. When did you discover that you were first pregnant?
When I was first pregnant, I was working in the uh, Department of Children's and Family, right? And my husband was working. Then I didn't I didn't have my monthly thing, and I was like, I'm kind of late, so let me check out. Let me see what's going on here. So I got a test done, and it was positive. So I was pregnant. I called my husband and I said, and I told him I didn't left my job that day. He left early that day as soon as he knew that I was pregnant. Um, and yeah, so it was a beautiful feeling. It was just the best thing ever, knowing that you're pregnant, and the whole process. It was just beautiful. I used to write a journal every time, like every week. You see me writing a journal about my experience on my pregnancy. Yeah.
Okay. Did you have periodic exams by your gynecologist, periodic testing?
I did. And all the testing it was perfect. It was beautiful.
Okay. I understand that at 32 weeks into your pregnancy, you had an ultrasound. Is that correct?
Yes, I did.
And the technician there told you that there wasn't any amniotic fluid surrounding the baby?
No, let me explain exactly what happened.
Okay.
Like I was at the doctor's office just doing a regular uh, testing, and that day was the day that they didn't do the ultrasound anymore. It was my first. They only do the one that they just hear the heartbeat. And previous to that appointment, I had my last ultrasound, which they didn't see anything that was going on. Everything was perfect. And then so I went to my next appointment, and on my next appointment, they didn't do the ultrasound. They only did the ultrasound where they only hear the heartbeat, and that's it. And I felt like kind of weird. I was like, I want to see my baby. I really want to see what's going on inside, whatever. But and she was like, no, because everything is fine. You're already almost on your time to have the baby, so there's no need for that. Now after this, we're just going to do the heartbeat, and that's it. So before I check out from my appointment, I see that there was a contest, and for a 4D ultrasound, for a free 4D ultrasound. So here I am filling out the form, and I put it back in the box, like I never thought of anything about that. A couple of days later, I receive a call that I won the 4D ultrasound. And you don't understand. I was screaming. I was just going crazy. Like, oh my gosh. You know how I was with this pregnancy. I was like, yes, I'm going to put a big picture on a picture frame and all of this. Like, I was already imagining everything that I was going to do with this 4D ultrasound. So here I go. I go into my appointments, and the lady, the technician, she was just like doing the ultrasound, and I don't see anything on the screen. Like, I don't see the baby. Like, it was just very cloudy. It wasn't clear. And she was just taking so long to just go over the baby and I was like, what's going on? And she was like, oh, it seems like you didn't have too much fluid. Next time I want to reschedule you. But just make sure that you have enough water before you come to the appointment, that you drink a lot of water. I said, okay. And I didn't think much of it. Like 2 minutes after I left the facility for the 4D ultrasound, I received a call from my gynecologist. Like 5 minutes after I left. And she said, okay, so you were doing a 4D ultrasound? I said, yes. I want you to come to the emergency room right now, and I'll be waiting for you. And I look at my husband. We were on the way to the mall to buy stuff for the baby. And we didn't think much of it. We didn't think anything because everything was fine. All the ultrasound was fine. So nothing negative came to me, like something was wrong with the baby. So I got to the emergency room, and I see a nurse that she was waiting for me in a wheelchair. I say, okay. She said, sit down. And I said, okay. So she takes me to the third floor, and I see a room like a labor and delivery unit. This is labor and delivery unit. What am I doing here? And I see the bed, I see the crib, I see everything, like if I'm going to give birth. And I started like freaking out. And she was like, we're just going to do a few ultrasound, and we're going to see what's going on. If the numbers is below 2, then we're going to transfer you to another hospital. I was like, okay. So they did the ultrasound and everything. The fluid, the number, I didn't know what was the number, what she was talking about. But then I find out that the number she meant, it was the amniotic fluid. And the number was below 2. It was like 0.4. And I said, oh my God, I'm going to get transferred to another hospital without knowing anything yet. And I see that they put me IV on. They give me shots for the baby lungs, like steroids. And she explained, I'm going to give you steroids just in case, so we can make the baby's lungs stronger. I'm like, what the heck is going on? So here I am to another hospital. I've been transferred to another hospital without knowing anything yet what's going on. Like, I will say like a week later, I was still in the hospital. I don't know exactly how many days I was there, but it was just a few days. I was already there. They checked my kidneys. They checked my husband's kidneys. And I have no idea what's going on yet. And I asked, what's going on with my baby's kidneys? And they were like, we don't know what's going on yet. We will let you know when after the result and this and that. So then they tell me that they were going to do a C-section. This is so weird. They were going to do a C-section, but then they're going to see what's wrong with the baby after the baby's out. They're going to study the placenta, and then they're going to let me know the diagnosis or if there's anything wrong. So I was already scheduled for the C-section. So the next day, there's a doctor that comes to the room and said, we're not going to do the C-section. I said, yes, I'm going home. Then he says, we already know what's going on with the baby. And that's when I got that diagnosed.
Okay.
Yeah.
Can you tell us what the doctor said to you about your child's diagnosis?
He says, your son, we already know what your son has. Your son has autosomal recessive polycystic kidney. I had no idea what that was. He will say, your son, he won't make it. He won't survive. I will have you to go home. He didn't explain anything. He just gave me the diagnosis. The baby was not going to make it. Go home. He was so dry. No empathy at all. Like even his voice, I still like gives me triggers every time I hear his voice. And he says, just go home. We're going to do a normal delivery. Just come back when it's time. We're just going to look after you. We're not going to look after the baby. There's nothing that we can do for your baby. Your baby is going to die after birth. Maybe a couple of days, or maybe right after birth, or maybe during birth, hours after birth, but he's not going to make it. Plain, simple, dry, just like that. How I felt, I was in shock. Like, I just couldn't swallow anything yet. I thought something was wrong. There was a misunderstanding. My baby was fine. The ultrasounds are fine. They must have something wrong there. There has to be something wrong here with the whole situation. This is not happening to me. My baby doesn't have anything. Like I was so in denial. Jim, when they were taking me off the monitor, IV off to send me home, I didn't want to go home. I said, if there's something wrong with my baby, you guys got to do something. You cannot just send me home. Please do something for my baby. I just couldn't go home. It was bad. It was bad how I felt.
Okay. And so we can explain to our audience, both you and Edwin had the gene for ARPKD, and under those circumstances, a baby would have a 25% chance of actually having the disease. Is that a correct statement?
That is correct.
Okay. I got to say hello to some folks. Friend of the show, Lisa Baxter's with us tonight. Jonathan Traylor says hi and that he's already reposted the broadcast. Way to go, John. Our friend Lawrence Herburst is on the line with us. So we say hello to everybody and thank you for tuning in.
Thank you so much for joining us.
So you talk about navigating the diagnosis. After they sent you home, what was your state of mind? How did you feel?
I was just alive, but completely deaf. Like I was just breathing because I was just breathing. I couldn't eat, Jim. I couldn't eat. I couldn't get up. I couldn't lift myself up. Like, thank God my mom was around during that time. She was just encouraging me, giving me so much hope to have faith, to to think like only God has the decision, only God can take it away. And just, to have hope, and just to giving me that thought, I was able to open my mouth, just to open my mouth, to be able to grab something to eat, and just do it for the baby. Just do it for the baby. The baby needs the food. The baby is still there alive, because I felt them. I felt them moving. I didn't have no amniotic fluid, but I felt them so close. And every time he kicked, it was just like, it was just hard to explain how I felt during that time. I cried so much. I cried every single day and night. I used to fall asleep crying.
Wow.
It's hard when you're giving this diagnosed that the baby's going to die, and then you feeling your baby moving around you, kicking, and you just knowing that when it's time, you're not going to have the baby there anymore, or he's going to be gone. And all I wanted it to do is just protect him. I just want him so bad, Jim. I just wanted my son so bad. And I was in such denial. I was in such denial.
One of the things that I understand that the doctor also told you is that when you come back, when the baby is to be born, that their emphasis would be looking after your well-being and not necessarily the baby's. Is that a fair statement?
Yes, that's what exactly those words he said.
Okay. And they talked to you about the risks of what could happen during birth at some point in time: miscarriage, premature birth, birth defects, stillbirth. Is that also correct?
Yes, yes. Since the baby didn't have amniotic fluid, there was a high risk that either he will become defect. Um, his lungs wasn't going to like, it didn't develop properly because of the size of the kidney was pushing so much, and it was just taking most of the space around his abdomen, and it was pushing up his lungs, and it didn't let the lungs develop correctly, how it should. And that was also going to give a lot of, because of his lung was much immature, and that was also what we it was the main cause of death. It was the main cause.
When did you go into labor? Approximately when?
2 weeks after the diagnosis, approximately.
Okay.
Yeah.
How did you feel at that time when you were being rushed to the hospital?
I remember that at that date I had an appointment with a doctor. Every time I used to go to the doctor, I had high blood pressure. And because every time I go to see him, to see the doctor, like they would do the ultrasound, and every time I went, the baby was getting worse. Like his cyst was just getting bigger, bigger. Like it was just, his kidney was just keep growing. It was just, and I was hoping that every time I went to see the doctor, like with so much prayer, I did so much prayer during that time after the diagnosis, and I was hoping that every time I went there was an improvement, and it wasn't like that. It was just, the thing was just getting worse, and I felt like God wasn't listening to my prayers, and I felt really mad about life, about everything. And when I got home that day, I felt like my back was hurting on and off. Like And I thought it was because I just didn't feel well, all this stress and all these things. It's just everything was just um but I didn't, because it was my first pregnancy. I don't know, I was having contraction, and I had my mother-in-law with me, and she kind of like, how long do you have the pain on your back, and for how long, and how long does it come back, and she was just like checking the clock and all that, because she probably thought like I wasn't like I was having my contraction. And she said, I think you're having contraction, I think you should go to the hospital. But the hospital was like an hour, because remember, so when I got transferred, I was in Port St. Lucie. That was like an hour away from where I got transferred from my house. And so to have the baby, I will have to drive an hour. So we drove to the hospital, and I was just, it was contraction. So they had me there, and it was time.
Okay. What hospital are we talking about where you delivered your son?
St. Mary's Hospital.
In Port St. Lucie, Florida.
No, that was in West Palm Beach,
West
Florida.
Palm Beach. Okay.
Yeah. I lived in Port St. Lucie, and I have my gynecologist there in Port St. Lucie. So, but then when I got diagnosed, I got diagnosed in West Palm Beach at St. Mary's. And the doctor that was taking care of me at the hospital, he sent me to his facility, which is there also as well in West Palm Beach. So everything was in West Palm Beach.
Describe for us your experience in labor and delivery. What went on? How did you feel?
It was very traumatic. It was like it was an experience that I don't I don't wish to anyone to experience. Um, I was in labor. I was laying in bed. I had all this monitor. Um, they have known me already, and I remember I said, I need to go to the bathroom. I need to go, and I don't feel anything. I felt trapped. I felt so trapped, like I couldn't move, and I couldn't go to the bathroom. But when you say that you need to go to the bathroom, it's because you're actually in labor. The baby's coming out. But I didn't know that. But there was so many doctors around, in and out my room. It was just crazy. And the doctor and everyone, that the nurses, they were like, just hold on, not yet, hold on, just hold it, not yet, don't let it come out yet, just calm down. And but before that, they had asked me this question. They said, what is that you want us to do with your baby? Do you want to hold your baby until his last breath and nurture and have this sacred moment with him, to have these memories, or do you still want him to put him on a ventilator? I did not know what to do. Obviously, I wanted to nurture my baby. I wanted it to have him. I wanted it to see him, to hold him, to kiss him, and to have these memories. But at the same time, I just felt like I didn't want to give up. And I thank God my mom was next to me, and she said, only God has the choice to say. And she gave me so much to think, and because at that moment you're in shock. You have so much going on in your body, everybody's around you. There's doctors in and out. You're just so confused about everything. This is my first pregnancy. This is my first everything. And my husband was here with me, but he was also in shock. He was just like right now, I think my husband has so much strength because he hold on so much emotion. So I wouldn't see how he was feeling. All I know that he was just there, at, by my side, but he had no words. He was just in shock. Like he just didn't know what to say. What was his? I didn't know. Like he was just quiet the whole time. And I told the doctor, and I said, um, make sure that he stays alive. Just do what you got to do to keep him alive. And that was the words that I say to the doctor. So when I was pushing the baby, no, before, there was a priest there as well. There was a priest in the room. I got upset when I saw the priest. The priest just gave me like a death vibration that I just didn't want to even picture anything like that. And I told the priest to go away, because just go away. I was mad. Go away. Like if I saw like a devil, like go away. And then I was pushing the baby, and the baby started crying as soon as he came out. And the doctor said, he wants to live. This is a fighter. He wants to live. When he said that, like, oh my gosh, like there was possibility, there was hope. And he was rushed. First, they put it on top of me so I can hold him for a few seconds. My mom got to hold him. My mother-in-law was able to hold him. My husband was able to hold him for a few seconds, and then they cleaned him up and stuff. And right away he was in NICU and on a ventilator. He was critical. He was critical there. He was transferred to Miami like the day after.
Okay. When you say Miami, which hospital are you talking about?
Miami, that's Miami Children's Hospital. Right now is called Nicholas Children's Hospital.
Okay.
Miami, yes.
And you talked to us already that his cysts were so large, they were pushing against his lungs and inhibiting their growth, making it difficult for him to breathe. And that's part of the reason that he was put on the ventilator right away.
Right.
Okay.
Yeah, because of his immature lungs.
Talk to us about Jonathan's medical condition for the first 2 months of his life and the challenges that he faced.
Yeah. So they were waiting to see, like, the goal, as soon as he got to the hospital, the goal was to take him to surgery so he can get dialyzed, so we can replace a catheter. But he was still critical to take him to a surgery, for a surgery. And he later on, during NICU, he developed a sepsis. Am I saying that right? Sepsis.
Sepsis.
And he developed that. He started, like, his body started to change. He got so swollen. He had a what is it called? It's a machine. It's a type of ventilator where your chest and your whole body starts shaking.
Mechanical ventilator?
There you go, that one. They had him on that one. All medication everywhere, a whole bunch of lines everywhere. He looked like like his whole body was swollen, and his abdomen, even though it was already big, his abdomen, but it got even bigger, and it's all a swell. And he didn't look himself. He didn't look like a baby. He didn't look like, I took pictures of
I was
that
going to
day.
say,
Yeah.
do I have your permission to show a photograph?
Yeah, but you don't have that specific one though. But you can share whatever you want. But
Okay, hang on.
mhm,
I'll show you the one that I have.
okay.
That one.
Mhm, right. That
Does that
one, mhm,
kind of give people an idea?
yes, but that one it looks way better than how he looks after when he was in with sepsis. Totally different. It was
Okay.
I took pictures because the doctor told us that if we wanted it to baptize him, that it was the time to do it. Because there were he didn't tell me this directly because I was the mom, I guess, and I was very emotional. But he did told my husband that, the doctor. He told my husband that if we wanted it to baptize the baby, that it was the right time to do it. Um, and then that's when during the baptize when we were doing it, I took a couple of pictures. I ended up deleting it. It was very it wasn't looking good. I couldn't see that picture. And I told my husband, please delete that picture. Please delete it. I don't want ever see this picture ever again.
Okay. Um, did there come a point in time when Jonathan was placed on dialysis? How did that come about?
After that, when we baptized him, after that, he started to improve. And few days after, they took him right away to the OR and they removed one of his kidneys. Then they placed the peritoneal dialysis catheter. I remember that one of the dialysis nurses went to the OR to help with the because they have to do it one manually because he was very small. His vessel was very, very small. So they have to kind of do something like manually, like a dialysis, but it was manually. So she was in the OR with the surgeons to help with the dialysis catheter. Yeah.
Okay. And was your son placed on dialysis shortly thereafter?
Yeah, right away. Right away. He needed it. They were like, if we don't get this done, this kid is not going to make it. He needs to be dialyzed. It was just
Okay.
an emergency.
On
Emergency.
an emergency basis, was that peritoneal dialysis?
Peritoneal dialysis. Yes.
Okay. And I understand that he was in the NICU for approximately 3 months before he was transferred to a regular floor.
Yes, he was. But there's something that we miss in here. And
Okay,
it's
go ahead.
part where me as a parent, as a mother, having your child going through the first surgery wasn't easy, Jim. Also knowing that he's going to go on dialysis, it was another process for me because I didn't really investigate much when he was diagnosed about dialysis because I was in such denial that I wasn't aware of what dialysis looked like. And I was afraid to look it up. I was afraid to see how all the system worked. I was just such in denial. And when my son went for surgery to get dialysis, it was a process for me to accept that my son was going to be on dialysis because even though I still thought of the miracle that he was going to be, that his kidney was going to recover, thinking that we were going home. And I every time they were taking off his medication of something, I was celebrated. Like the nurse saw me going crazy just because they took him one medication off. She pulled me aside and she said, Yubi, this is a long journey. This is a long, long journey. That was like a smack on my face. That was a smack on my face. Like, wake up. Wake up. This is your reality. Dialysis is your reality. This is your journey. Wake up. And that was hard for me. That was hard.
After he was placed on a regular floor, it's my understanding that he continued to grow and get stronger. Can you tell us during that period of time what was going on with Jonathan?
Yeah. So after being 3 months in NICU, we were transferred on a regular floor for another 3 months. Basically, during those 3 months, they were educating me. They were teaching me. They also see how the machine, that machine from dialysis was like, sometimes when they're new on certain machine, they have to see if those numbers or the setup that they put in there works for him. They were also teaching me how to program the machine, the dialysis, the peritoneal machine, the dialysis machine, and how to operate it, how to program with the um, with the numbers and everything, and how to connect them to the dialysis, and everything was very overwhelming for me, very overwhelming.
Okay.
Yeah.
All right. Did there come a point in time where Jonathan finally got to go home?
Yeah. We went home, and after being 6 months in the hospital, we drove back 3 hours. We were like 3 hours, almost 4 hours away from home. And we went home. Jonathan Jonathan started like to throw up a lot, and he was just didn't tolerate his feelings. Couldn't tolerate his feelings anymore. And it's the doctor was saying that it was time to remove the second kidney, because of the second kidney was just growing. And even though his feedings, it was all the way down on his duodenum. Am I saying that right? In his dual, like it's after
It,
the stomach.
on his intestines,
Right.
his duodenum.
There you go. So it wasn't not even in his stomach, the feeding tube, and he was still not tolerating it. And the doctor brought him back, told me come back to the hospital, and we might have to remove his second kidney. So after being a month at the house, we ended up going back to the hospital.
Okay. And how did the removal procedure go?
Well, they were hesitating because I have two well, when one nephrology is not on call, then another nephrology comes over and take over.
Right.
This nephrology was not agreeing with removing his kidney. One, because it was still at least giving maybe 5 or 10% of functioning it was like producing something. It was doing something, at least 5% or 10%. And he said, I take those 5 or 10%. Let's just keep it, let's just try. And my real doctor was like, no, this kid can accept no feedings. He needs to remove. So it was a debate, and it was kind of very difficult for me to comprehend. It was difficult. But we ended up removing his kidneys. And the reason why the other doctor felt like it wasn't a good idea was because the dialysis, he's going to be on the dialysis, or like 100%. It was going to be very more intense, more heavy, and he might not tolerate all of that. And that was his worry. But, and then my other doctor was like, we don't have a choice. We have to do it.
Okay.
We're doing it. Yes.
How long was Jonathan hospitalized this time?
For another month.
Okay. After you got home, how did you and Jonathan do with home dialysis?
First, when I was learning how to do this thing, Jim, I wasn't even thinking of any being a anything about related to doctor or a nurse and all these things. It wasn't interesting in me. I went to school for business administration, nothing to do with nursing, nothing to do with it. It was never my interest. When they told me that I have to do all these things at home, I was freaking out, like freaking out. Oh my gosh, what if I do it wrong? What if I mess it up? What if he get an infection? What if I don't know how to do it? What if I forget things? What if I was going nuts? And I remember when the nurse was like teaching me, I was shaking, like literally shaking, because it was just too much. It was overwhelming. But I ended up accepting it, and I did it because I was like, in order for me to go home and take my baby home, I need to do this. And I need to learn how to do this, and I need to learn how to do it perfect. So I did it. I mastered it. I took him home, and I was able to do it at home. And I remember that before I connect him to the dialysis, I had to wash my hand like if I was going to do a surgery, like finger by finger everywhere. It was crazy. And washing my hands like that, then wearing gloves, wear my mask on to enter to his room to start preparing everything on his dialysis. I remember that I had like a table to to put the sterile pad and to throw all that stuff that I'm gonna be using. I remember that I had to connect the bag, the substance that the bag with the solution, and then I have to prepare it. First, I have to make sure that there's no drainage, that there's no tears, making sure that it's not expired, that it's good, checking the liquid to see if it's clear. Then I have to put a heparin solution into the solution bag. And everything was like a procedure. Everything was like, so like, I'm doing a procedure here. I'm doing a surgery here. So I did it like that. I connected the solution bag with all the feedings, all the tubing, and yeah. So before I connected him, I had to do his vitals. I had to get his weight. Then connect him to the machine, connected to everything, and it was 12 hours continuously throughout the night.
Wow.
And also I had to connect them to the feedings at the same time while he was asleep for 12 hours.
Okay.
Yeah.
How many times a day was Jonathan actually doing peritoneal dialysis?
Every single day. Every day.
Okay.
For
For
12 hours.
12 hours. The sessions lasted 12 hours. You also mentioned to me something about hormone shots. Can you explain what that was all about?
Yeah. Jonathan, he didn't make those hormones, the growth hormones, because he didn't have no kidneys at the moment. So he was pretty small for his age. So we ended up doing his shots. It was kind of difficult for me to do because my husband was working. I was alone at the house with my baby. Um, the neighbors where I used to usually talk to, she couldn't help. She used to be scared. She used to hit, no, 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 I'm not doing that. I was like, just to hold his legs, just to hold his arm. No, 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 no. I'm afraid to hurt to I'm gonna hurt him or something. So I was alone doing everything, the shot and everything. And I used to wrap him up in a burrito and with his leg out and hold him tight like that and grab his leg and do it. He used to cry so much. And after I was done, I'm sorry, I'm sorry, I'm sorry. I used to kiss him everywhere. I'm sorry, I'm sorry, I'm sorry. It was hard for me to do that. It was heartbreaking for me to do the shot.
Okay. Let's talk a little bit about what was going on with John's feeding tube and how he took nourishment and if he had any issues at that time.
Yeah, he had issues with his feeding tubes because sometimes you see the feeding tube, it was like through the nose, right? I used to tape it, but it will slide. It will slide out if you don't pay attention to it. Even if you have the tape on it to secure it, sometimes it will, and that could be very dangerous because if it pulls a little bit out, it might just end up being on his lungs. So what I used to do is I used to mark if the tube was here, I used to mark it with the pen, a line to make sure that the line is really close to his nose. If I see that the line was up here, then it meant that the feeding tube was pulling out. And sometimes when the feeding tube didn't work, I ended up going back to Miami Children, which was like almost 4 hours away, to get help with his feeding tube to put it back in his nose. Until one time, for me going back and forth so many times for the same issues, they told me how to put it in, and they said you can do it yourself. You just do it, and they told me how to do it. Oh my gosh, it was so traumatic for me to do that. Every time that it was pulling out.
Okay. Our friend Lisa's asking a good question. I want to pass it along to you.
Yeah.
Did you have any help? Did you have a home attendant or a home nurse that would come in every once in a while? Anything like that?
No.
Shaking her head, no.
No. I did have an emergency contact. But most of the time I used to go back to the hospital. If I didn't feel safe doing anything, I would just go back to the hospital 4 hours away. I would just drove back.
Okay. Did there come a point in time when you had to go back to the hospital to remove the other kidney?
What was the question again? I'm sorry?
The kidney they left behind. Did you have to go back to the hospital to have that kidney removed at some point in time?
Yeah, I mentioned that I ended up going back after because of the feedings, because he wasn't tolerating his feedings, and I ended up going back to the hospital because they had to remove. They did remove it. So he was with more intense dialysis, peritoneal dialysis. Yeah, more intense.
Okay. I want to call your attention to the point where he's 2 years old. Were there issues with his peritoneal catheter at that time?
Oh my God. Yeah.
Can you
Um,
tell us a little bit about that?
yeah. When he was two, this is when he was two, it seems like his, because he had this peritoneal catheter since he got, since he was 2 months old, right? When he was in NICU. It was the same catheter. And the the line that was connected to the site of the catheter, it was twisting. It was like twisting during dialysis, and it used to beep all the time. And I had to like correct it and fix it and put it straight like that, so the fluids can pass through. So many nights it was just twisting. It was like that all the time until it broke, and it started leaking. As soon as I noticed that it started leaking, I stopped the dialysis and everything, and I called the doctor. They told me to Miami again. So I drove. Um, they put him on antibiotics and everything, all of that. They tried it. They fixed it. They cut it, and they put it back inside the. It was just a part of the tubing where it connect the line, and they fix it. So I went back home. The same thing was happening. It was already leaking again. So it was like that, back and forth, back and forth, back and forth, until one time they ended up um, they ended up changing it, and he went to surgery and they replaced it for a better and bigger one. But what happened is that when he got the new catheter, I got home and he was leaking, but not from the tubing, but from the site. And he was just leaking. He was leaking. I called the doctor. He says, just change his dressing during the day, throughout the day. Just change it. I was changing his dressing and to change the dressing is a procedure. It's like doing a procedure. Wash your hands, do it in everything. Everything is sterile. I was by myself all the time, and I was doing it. You know where you change the diaper change, the table where that was my base to do everything for him. I saw him, I lay him in there, and I did everything, all the procedure that I needed to get done there. So I was changing his dressing all the time, and every time he was still draining, changing dressing again. It was to a point that his skin got so irritated, and every time I was pulling off the tegaderm, the tape, he cried, and I put it on me to see. Oh my God, Jim! It was like peeling off my skin. It was like peeling off my skin, and I said, I'm not gonna do this again to my son. I'm not gonna. This is not. This is unfair. This is not good. I'm going back to the hospital. They have to fix this. I'm not going to be doing this no more. But I did this for a few days, and I said, I can't do this no more. I went back to the hospital, drove back again for 4 hours, and they ended up putting a, no, no way. Let me tell you something. He got peritonitis because all these things. He got peritonitis because every visit that I went because of the leaks, like I ended up being in the emergency before they put me in the in any room. You have to pass through the emergency room first. In the emergency room, all the nurses and doctors, surgeon, they came to see the site. They were opening the site and just wearing regular gloves, and I'm like, no, 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 no. Take me to the floor, please. Just take me to the floor. Um, Anyway, he ended up with peritonitis. That's when they changed his catheter. I messed up there. That's when they changed the catheter because the catheter was already infected. So when they changed the catheter, I went home and then he started to leak from the site. I start removing the tape. I said, you know what? This is not fair. He's hurting my baby. I'm going back to the hospital. They have to do something. So after going back and forth, I said, no more. They ended up putting him on hemodialysis because they said that what happened was that his abdomen, after having that peritonitis, he had too much fiber in his abdomen, way too much fiber from the peritonitis. And he couldn't tolerate any more catheter in there. So there's no more for peritonitis. He couldn't go back ever on peritoneal dialysis.
Okay. My friend Lisa's a social worker, and she had a couple of really good questions. She wants to know, at that point in time, did you belong to any pediatric kidney foundations? Were you part of any support groups? Did they offer to put Jonathan in rehab and anything like that?
No, I didn't have any support like that. During that time, there was no Facebook group. There were no. So I didn't have no support as just my doctors and nurses. That was it.
Okay. After he was put on hemodialysis, how did he tolerate that? Were there complications or problems? Did things continue?
Well, first, accepting hemodialysis, that was another process for me. When he was on when he had the peritonitis, of course, I blamed myself for it. And I couldn't accept the fact that my son was going to go into hemodialysis. And it was hard for me to see other children on hemodialysis. It was very hard for me to see that. And having my child on hemodialysis, it was even worse feeling for me. It was very traumatic. It was very traumatic for me. He did have a lot of complications while he was on hemodialysis because his vessel was very, very small. And every 3 months, no lie, Jim, it was every 3 months, catheter change. For 2 years straight, it was catheter change. There was a time that they ended up doing, he was in ICU, in PQ. They ended up doing, it's one of those hemodialysis that they do, and there's like temporary catheter. It's on the leg by their thigh. It was very traumatic to see that to me. It was see him having dialysis through a leg and see him so tiny, small baby going through that. It was hard. Seeing him every single time on dialysis, there was always an issue with his catheter, always an issue. If it wasn't clot, it was just that the dialysis wasn't circulating, or sometimes one time in ice during PQ, he was doing dialysis, but he had the site right here on his neck. He was doing hemodialysis, and out of nowhere, the catheter, I don't know what happened, but it started blasting blood everywhere from the hemodialysis catheter. We were in the ICU, PQ, and I don't know how I didn't pass out during that time. And all the nurses, all the doctors everywhere were there holding my son because he was moving. He was crying at the same time, and everyone was scared because he still was bleeding, and the catheter and everything was bleeding. It was blood everywhere on the floor. And uh, I wasn't in my in my 5 cents during that time.
Okay. Is this the point in time where they were talking to you when he was around 4 about the difficulties with the catheter replacements?
Yeah, when he was 4, almost 4, he was 3 and something, but he was almost 4. There was a moment that the catheter, we didn't, the surgeon couldn't take him back. The surgeon said, um, I mean, they said I could take him to surgery, but I don't guarantee that I will come back with a catheter. He doesn't have any more spot anymore. All his vessels are are, are broken. Like he didn't have any more for that catheter. They couldn't find any more spot. He was done. And during that process, I felt so hopeless. I thought like it was the end. I thought that was the end right there.
Okay.
Yeah, for me. I thought it was the end.
Just so people understand, the doctors told you that if this last catheter didn't take, there wasn't anything else they could do for Jonathan. Is that a correct statement?
Not exactly like that. I remember that when that was another time he had a virus during dialysis. He just had a really, really, really bad virus, and he wasn't conscious. He was out of it, and he had a really low blood pressure, and they couldn't bring his blood pressure up. They'll give him so much bullets of fluids, and nothing was working. And he was having this problem for a few days, almost a week. And the doctor said, if he doesn't improve by tomorrow, there's nothing else that we can do. And that
Okay.
was hard. That was hard.
I know that from our prior conversations that you are a woman of faith.
Yeah.
After you learned this information, can you talk to us a little bit about what happened?
When he was 4, I mean, during the virus, he made it through. He was fine. His blood pressure was up again, and things got better. But then we still had problems with the catheter. So when he was 4, that was it for him. He was already he was due for his dialysis already for 3 days, and he needed to be dialyzed. But the catheter didn't work. They were trying to stitch him. They numbed the area, and they tried to fix it somehow, and stitch his skin through the catheter, and they did all these things, and still didn't work. The doctor didn't want to take him to surgery. They just didn't know what to do. And I remember that day, I cried so much. And I said, I really I just gave up that day. I gave up, and I talked to God, and I said, God, please, just please, do it something, do a miracle, have mercy, please have mercy. And I remember I was so hopeless that I was just going to, all I wanted is a call for the transplant. That's all I was asking for. And I remember that I wanted it to go outside with a sign saying, I need a kidney donor. Because I was desperate. I was in such a desperate mode. And I went back upstairs and I said, God, please. And I was like, I just couldn't, I didn't know what to do anymore. And I saw a priest walking down the hall in the unit. And I said to him, can you come and say a prayer for my son? And he said, what is that you're asking for? What do you want to happen? And I said, all I want is a call for his kidneys, for his transplant. And Jim, after we did the prayer, like 2 hours later or 3 hours later, I received that call. And I was in the hospital. And they didn't call me directly, but they have called the doctors. I don't know exactly what was behind all of these things. But that day, he got his kidney. He got his transplant. He was transferred to another hospital for the transplant, though.
Okay, which hospital was that?
That was Jackson Memorial Hospital.
Okay. Talk to us a little bit about the transplant. What took place there?
Okay, so when we got transferred, we were on PQ and at the Jackson Memorial Hospital. The doctor says, where is his catheter? We need to get him dialyzed before the surgery. And we told them that catheter doesn't work. They went all crazy. What? It doesn't work? Oh my God. And then they started like to see what was going on with the catheter. Jonathan was crying. He was saying, no catheter fixed, no catheter fixed. Because it was like, because the same day they stitched him. And they did some stitches on his skin to fix the catheter that he had. And he was awake during that procedure. And he was already traumatized. So when we got to the other hospital, they were trying to do the same thing. And then he was like, no catheter fix, no catheter fix. And we had like in our room, it was full of doctors around the room, full of doctors. Jonathan crying. I'm going crazy on the other side. I'm just crying, going crazy. I don't know what was going to happen with my son. I don't know if he was going to die that day. I don't know if he was going to be able to be dialyzed. I didn't know if he was able to get his transplant. So it was so many things going on at the same time that I was like extremely overwhelmed with emotions. And I remember there was one nurse that came, or a doctor, I don't know who came, but somebody that worked there. They came to me because she saw me crying, and she said, Yubi, you don't want your son to have his transplant? And I said, of course I do. But why are you crying? You should be happy. And it was just like so many things that are going on that I wasn't able to control my emotions. And then when I heard, because I ended up leaving, because they ended up taking me away from the room because I wasn't being myself. So they ended up taking me out of the room because they were placing a new catheter right there in that room in PQ where I was sitting next. And they had to take me out because I was crying. I was going crazy. And I hear when I was in the hallway talking to this lady, like she was telling me, why are you not happy? You should be happy. And I hear, we got the catheter, we got it in. Everybody was crazy. Everybody was just so happy that that they were able to have a catheter for his hemodialysis, and they were able to dialyze him. The kidneys and the liver came from the same donor, and he came from Texas, and he flew to Miami. Um, and but like, it's crazy because we didn't know, because it's certain time they have to measure the time for the donor's organs. If they take it out in certain time, you have certain time to put it in the body, or so everything was timing. Everything was about timing. And it was scary because we didn't know if Jonathan was going to be able to get that because of the issue with the catheter. So it was a mess that day. But when they said that they got the catheter, that's when I said, okay, he's going to have his transplant. Okay, he's going to have his transplant. So that's when I started to calm down, that he was going to make it, at least that he was going to get his blood clean and all of that. And then they took him to surgery right away, and right after that dialysis, they took him to the transplant. It was hard for me to leave there. Yeah.
And no mental health professional during this whole period of time ever offered to help you?
Like in how?
Dealing with these issues, your emotions.
No, I didn't have no support, no emotional support. I only had my nurses around, which I am so grateful for them. They were like my angels, my guiding angels. I didn't have no advocate. The social workers, there are only certain things that they can help you with, but not with your emotions.
Okay. And I want to make sure people understand this was a double transplant, a liver transplant and a kidney transplant. Is that correct?
Correct.
Okay. Very good. I take that the operation was a success?
Yes. The surgery was was over 20 hours.
Aye.
Because
Wow.
they had to remove his liver. His liver was the size of a football, American football. It was very big. And just to remove that liver was about more than 5 hours. And they have to replace it, and they have to replace the 2 kidneys. So it was a long hours. It was the longest time that I ever experienced.
Okay, just so our audience understands, sometimes with a pediatric kidney transplant, they transplant both kidneys. Is that the situation with Jonathan?
I don't know if that's the case, but his nephrologist and the whole transplant team, that was what they wanted it for my son. They said that they wanted it, instead of 1 kidney, they wanted it to have 2, and they wanted it to come from a baby kidney, from a baby instead.
Somewhat comparable to his age.
Yeah.
Okay. Mm-hmm. Okay. Talk to us a little bit about Jonathan's current conditions and challenges. What's going on with Jonathan today?
Well, Jonathan, he is a very happy child. He's in school. During his period of his first grade or second grade and stuff, even when he was in 5th grade, his writing was like a 6-month-old writing. It was bad. He didn't have this his muscles was very still weak. His muscles still weak till this day. But his not being able to write, not being able to catch up with everything in school, he is behind right now on his academic. He is in eighth grade, but his real level it's about 5 or 6 grade, 5 to 6 grade. And he is a very, very smart kid. Very smart kid. He's actually writing a book right now.
That's great.
Yeah. But
My,
mhm.
go ahead, Yuberky.
He was diagnosed with ADHD as well. Um, which is like affect his education like in school, but he get distracted. He's not like um imperactive. He's very he's calm, he's very, you know, but he has attention deficit kind of thing, so it is affect him in school. um he has hearing loss, so he's wearing his hearing aid. He he's he recently stopped wetting his bed. He used to wet his bed every single day. So thank God, no more. But this is a recently thing that has changed. He does takes a speech therapy. He gets physical therapy, occupational therapy, and he still needs those things. Um, what else? But that's the basic. And now what they're doing is that they doing a fiber scan as well to check his liver and to see if there is any indication of rejection. Also, they also do like a biopsy on his liver to see if there's any rejection or anything like that. They did find a an a two antibodies that is still there, and it's been there for quite a while now. It's been there for almost 3 to 4 years. Um, they started like giving him steroids for that for a couple of months. Nothing didn't change. Everything's still the same. So they stopped his those medication, and now they just monitoring his counts, but he's stable. We just got to keep an eye on those antibodies.
Okay. What's going on with his eating?
Oh, he's eating. After his transplant, because he was since he was born, he was in feeding tubes, and they keep saying no, he will eat after the transplant and this and that. But the way that he was like, he would not take anything. He wouldn't take anything, not even a sip of water. Uh, and he didn't want to eat nothing, 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 nothing. So after his transplant, during this transplant, they put a feeding tube on his belly. So he didn't have the one in the nose anymore. But what happened was that I started feeding him through the mouth and having these conversations with him, like we have a mouth to talk, we have a mouth to eat. See how mama eat by mouth. See how daddy eats, everybody eats by mouth. So I started having this conversation with him. And I started with the syringe, feeding him the same formula that he was supposed to get through his feedings. I used to start feeding him that. It was a process. I used to spend 2 hours each feedings, So I used to feed him 3 bottles of those of the formula. So I started with the formula first and feeding him with a syringe. The speech therapy said, do not feed him with the syringe, feed him with the spoon. But every time I would come with the spoon, he would turn around. He would do this. So I couldn't. So I had to do it with a syringe. For a few months, he ended up taking all his formula through a syringe. And once I knew that he was able to take the formula myself, I removed his feeding tube by myself. I didn't tell the doctor. I didn't tell anyone. I just took it off. And because it was a point that he was pointing into the feeding tube, he was like, to do it through the feeding tube. I said, no, we got to eat by mouth. No more. You don't have the feeding tube anymore. So you got to eat. So that's how I was able. And then after the formula, I started with like making food, liquid food. And I would still do it with a syringe. And I learned a trick to feed him when he used to say no to me. So I used to play his favorite cartoons, which was Elmo during that time. I used to play it. And I used to pause it to feed him. And I used to say, if you don't eat this, then I'm not going to play it. And then he would drink it, and then I play it, and then that's how we used to I used to make him eat like that until there was no more. It was just like leveling up a little bit, and then, until he gets it done. But I got him to eat. Solid as well. But it was
Excellent.
a process. I had to have it. I had to be very patient. I spent 2 hours, 2 hours in the morning, 2 hours in the afternoon, and 2 hours at night before bed. So 6 hours feeding him a day, 6 hours.
Wow. You are patient.
The
Yubi,
doctor
don't
was
let
like,
anybody ever tell you any different. You are a patient
the
woman.
doctor was like, don't feed him for so long. If you spend more than 1 hour, stop. Stop right there. I didn't listen. I was like, no, he needs to eat. I'm not using this feeding tube anymore.
Okay.
Yeah.
Talk to us a little bit about, in your words, turning adversity into thriving. Can you describe for us how you have managed to overcome all of this adversity?
Because at one point, I just stopped for a moment and I said, why all this thing is happening to me? What the heck have I done to deserve so much suffering? And why can't we just be a happy family? Because it was not only my son like going through so much. Then I lost my dad. Then I lost my mother-in-law, then my father-in-law, and we were just like, what the fuck, Like, what have we done in life? Like, what did we do? Like, this is karma from our past life? What the heck? And like, I had so much pain within me, so much anxiety, so much fear, so much grudges, so much like anger, so much bitterness, like I had so much sadness. I was suffering so much, and I felt like all this, it was heavy to me. It was just super heavy. And I remember carrying it, all these feelings, all these emotions for so many years that I was just drained. I was just like, God, I couldn't go to school. I couldn't have a profession. I wouldn't leave my son. Like, I have to work. I have to make money to support my family. I have to, like, what is that I'm gonna do with my life? This is not my life here. I want to live good. I want to have a happy life. I want to have, and I thought, like, in order for me to have a good life, I need to go back to school, become a professional. But in order for me to go to school, I also have to work, and I also have to take care of my son. I cannot do all three. So I was like, okay, so school is out of the question. I can't go back to college. I have to work, and I want to take care of my son. And so school was out of the question for me. And I said, okay, what am I going to do with my life? What am I going to do with my life? And I was so, like, with all this heaviness that I had, carrying all this emotion with me every day, all day long, for years after years. And I have a time where I said, enough is enough. I have to do something. There's something that I have to do, because if I don't do anything, life is just going to repeat itself for me. Everything is just going to be the same for me. So I knew that I have to do something. I just didn't know what it was. And I started, like, searching for stuff. I started going on YouTube and searching for mental health. I started, like, searching for Tony Robbins. I went to a free event, virtually. And a lot of my questions were answered there. Then I started having new peers, new friends, that it was matching my new frequency. It was matching my peers that want to grow in life. Peers that were actually going to help me move forward. And I left everybody else, like, that wasn't helping me to grow. I left them behind. I changed completely my surrounding, my environment. I was surrounded with people that will help me move forward, that will help me with my emotions. I met a spiritual healer, which she made me see life with different lens, life with different perspective. And then that's when everything changed. That's when I started seeing the light through all this darkness, and gave me so much strength and so much inner peace, so much that I actually teaching all these things to my family, to my son, because I always thought, like, my biggest fear was to leave him behind, because we know that we don't last forever. We, at one point, we will go. And my son is my only child, and that was my biggest fear. My biggest fear was to leave him and have him to deal with his illness by himself. And I learned that if you have inner peace, if you have joy, if you have happiness, the real happiness, the real inner joy, the real inner peace, you don't need nothing else. It doesn't matter what you're going through. It doesn't matter if you're going through difficult times. But if you have that inner peace in you, you're okay. You're going to be okay, because you already. So in order for you to have that inner peace, in order for you to have that joy in you, you have to have a trust. You have to have the trust that everything is going to be okay. And everything will be okay.
Okay. Let's talk about your advocacy work a little bit. You mentioned spiritual healing. Talk to us about being a wellness coach.
Yeah. Um, the wellness coach, basically, I just want people, especially parents, because I don't work with everybody. My focus is more with parents with of children with chronic health conditions, where I can put myself in their shoes, where I can have much understanding for what they're going through and much understanding of the pain and their suffering. And and um and I feel like if they see that I have this understanding through my story, they can see that if I can do it, they also can. They also can. And what I teach them is when to find that inner peace and that joy. So once you find that inner peace, inner joy, your life, or like you will thrive. You will thrive, because when you're suffering, when you have this stress, when you have this anxiety, when you have all these things, it's create like a cloud that you can't see nothing beyond that, and it's just block you. It just make you stuck, make you feel like you can't go anywhere. And when I teach them how to find their inner peace, inner joy, they start seeing life with more clarity. They start seeing a lot of more things that they didn't see before, where they can find their purpose, when they can find their reason to live, they find their reason to be alive. And that will help them thrive. That will help them decide what they want to do with their life. And I'm there to guide them. And I'm there to help them through the whole process, to get them where they want to be.
Okay. Let's talk again just for a minute about your Facebook advocacy page. Thrive Together, a community to empower parents to find peace and true happiness. The link is scrolling across the screen as we speak. What is that Facebook group all about?
I gather parents. I gather parents that has children with chronic health conditions, and especially with kidneys challenges. And I do podcasts like this. I do interviews. I have a topic. I teach them some of my experience um, and things that I've learned. I teach as much as I can, and yeah, that's what I do on my Facebook group page on Thrive Together, and bring parents together as well, and they can communicate, they can have their support as well, find people just like them, and know that there's always light at the end of the tunnel. And that's what I'm trying to project on that group, that everything is possible, that no matter what you're going through, you can also thrive as a parent.
Okay. You have a Facebook event coming up June 30th through your Facebook group. Can you tell us a little bit about that event?
Yes. So I created a Facebook group for this specific encounter, where I'm going to do like sessions. It's like a group, face to face, virtually, and where I can see them, they can see me, we can all interact. They can ask any questions they can share their story, what they're going through, their challenges. I will also be giving information. I will be giving lessons, healing sessions, and it's just a beautiful thing. And I decided to do a 4 free sessions. Um, it's every other week, so it's going to be starting on the 30th, June 30th, and I'm just going to do it every other week for 4 sessions. So, and it's free.
Okay. I understand also that you're writing a book. Can you talk to us a little bit about that?
Yes. So basically, what I'm writing right now is a book where I put in the strategies that I use, uh, and I explained with every situation of my story, like what I should have done during that time if I would have the knowledge that I know now. Um, and and putting that knowledge into those circumstances that I've been through. And so people can actually see if they're going through the same circumstances and the same, they can relate to my story, and they see the strategies that I use in every situation. Um, and it's just, yeah, and it's about that. It's just like like teaching everything that I have learned through the whole process.
Okay. Lisa's asking about the link. Lisa, I just scrolled the link, and if you go to my Facebook page in the comments to this broadcast, the link is there as well. So you should be able to find it. Okay.
I
Well,
also I'm also providing to everyone a free 90-minute session for free.
individual session type
Yeah,
session.
individual 101 for free.
Okay. We're in the home stretch here, Yubi. Can you make a final statement? Tell us if I forgot anything or if there's something in finality that you would like to say to our audience tonight.
I would like to say 2 things. One of the things that I will say is that if you're going through a difficult time, if you're going through such a challenging moment and you feel like you have no choice to be on that state, just know that we are a spiritual self. Like we are a light. We have our spiritual, and just take a moment when you're by yourself, when you're alone, just like fly above the storm, and you'll see, like you will feel so much freedom. And because we're capable to do that, because we're powerful being, we are intelligent and very powerful being, and we are limitless. And when we focus in our light, when we focus on our spirit, we can go beyond anything, beyond any storm. And know that the storm doesn't last forever. Nothing lasts forever. No storm lasts forever. Nothing lasts forever. So where you are, it's just temporary. It's just temporary. There's light at the end of the tunnel. And another thing is that everything that we go through in life, everything that we go through life, it meant for us. It meant for us, for our growth, for our evolution. Because if I wouldn't gone through all this that I went through, Jim, I wouldn't be here sitting next to you or sitting with you and talking about all of this. Not at all. And that's what I will say. Like, I believe so much that everything happens for a reason. There's a purpose behind. We might not understand it now, but we eventually will understand it.
Okay, beautiful. There's one other thing I wanted to bring to your attention, Yubi. Lisa Baxter has left other organizations in the chat that perhaps you might be interested in working with. So after the broadcast, you might want to check out those comments where she's disclosing those organizations, if you're so inclined. And the other thing I wanted to say is I want to say thank you for coming on tonight, letting me ask all these questions for 2 hours, being very patient with us, sharing your tremendous story. I just want to say I wish you and Edwin and Jonathan all the luck in the world, and please keep us updated on how John's doing, and fingers crossed that he continues to improve at the rate that he's improving, and that someday we'll all be very proud of Jonathan for his tremendous perseverance, and we're already proud of you and Edwin for your tremendous perseverance. I have a few things. Oh, no worries. You were great. So I like taking the night off. I should have just put my feet up on the coffee table.
Do that now. You're fine.
So I'm going to let you go. I have some things to button up with our audience, but I just wanted to say what a tremendous job that you did. And I'll be checking in with you guys on the 30th.
Thank you. It was my pleasure to be here, Jim. My pleasure. Thank you so much for the invitation.
Oh, no worries. Happy to do it. Very happy to do it. Just a wonderful broadcast. I was very happy to be able to share it.
Thank you. Thank you so much. And I hope that this broadcast will help someone today, or someone that really needs it. I hope that it will do something for them.
Right. And as you know, Uncle Jim's going to publish an instant replay. And so if people missed it, they'll be able to catch the replay. And I want to say to our audience, please, if you know someone who is the parent of a child with a chronic condition, like polycystic kidney disease, please don't hesitate to share the broadcast with them so they can come and see and give us feedback, help us get better. And maybe learn something, because Yubi's gone way out of her way to raise awareness this evening, just way out of her way. It's tremendous learning experience for all of us.
Yes, thank you.
All right, folks, that is our broadcast for tonight. And I wanted to tell you, next week is July 5th. We're taking the 5th off. It's the day after the 4th of July. I didn't see any point to doing a broadcast on the 5th. We're back on July 12th with our friend LJ Dong. She is scheduled to be on the broadcast at that point in time. This is a remarkable young woman, a person that is a kidney donor, and a beauty queen, and a psychic, and writes books, does broadcasts into all sorts of things, trying to help other people. So you don't want to miss that broadcast. But again, next week, the 5th, no broadcast, okay? And I'll make sure that I post that. So uh, people will know, and I won't get all these notes. Where are you, Uncle Jim? Uncle Jim's taking the day off, man. That's where I'll be. So
Gotta rest.
yeah, a little bit.
Yeah, I
Uh,
gotta rest.
all right. Well, that concludes our broadcast for this evening, and I will see you all on the 12th. And I thank you for tuning in, and we will talk soon. And like I always say, continue to watch this space. Bye bye for now.
Bye bye. Hello.
It's okay, UB. You can go. I'll drop you a note.